Okay, Jelly Bean, here we go. Compounding 101 with Doc Riddle. What I'm doing today is trying to provide a demonstration to you of a way that you can mix up Einstein's 3 medications into one syringe so that you don't have to do repeat dosing or overload them with water. What I have here is this is actually a 60 ml syringe, oral syringe. That's to represent your 35 ml. I've also got a 3 milliliter syringe. This is a standard IV syringe, but same volume as your little syringe, and there you go. I've got 2 tablets. I've got a half tablet, this orange one, that'll represent our doxycycline, half tablet. I've got this pink one that's going to represent our prednisone, full tablet. Now you see I already have some fluid in the 3 ml syringe. Okay, that's about 1 milliliter, and that's going to represent our Clavamox. I have also put about 6 ml aside in this little shot glass here, and you can see 6 ml is not very much at all. Okay, what I would do is set that water aside first with your small syringe, or if you want, you can pull up about 5 milliliters or so into your large syringe. That will work as well. So the first thing that we're going to do is put our 2 little tablets in the bowl. You don't have a mortar and pestle, so go ahead and use the back of a spoon and a standard bowl and break those up. And crushed. Be careful when you're crushing so you don't send powder flying everywhere, and you want to keep it all kind of in the same area of the bowl because we're not going to be mixing it with very much fluid. If you had a small mortar and pestle, that would be best because it would be not as big as a soup dish. But we're going to grind that up as best as we can. Until it's nice, relatively fine powder. Okay, now what I want to do, since I've got such a large bowl, is kind of get it all centered in one area if you can, and then keep it at an angle if you can to keep everything from spreading out. So once I got my little fine powder puddle, if you will, okay, I'm going to take my dose of Clavamox. Now I'm starting with this one because it's already in a liquid form and you're trying to mix everything in the same syringe. So starting with this is good because you can start to make your suspension with something that's already in liquid. Whereas if I started with plain water, I would have to use more liquid in the end, you see, because I would be mixing everything with plain water, trying to get it all drawn up, and then I would still have a Clavamox dose to give, which is just more liquid. So here I'm going to take the Clavamox and just kind of ease it in over that fluid. You can do a little bit of it. There I did about a half a mil. Trying to keep it all in that same area, work it into a paste. So you're not trying to pull up dry powder. Okay, I got a nice little paste. So I'm going to take that other half a mil, go ahead and squirt that in. Okay, I'm going to mix that up. Now it's a highly concentrated suspension. It's like much, much thinner paste. Okay. Now from the stuff that I have in the bowl here, I'm going to try and get all that drug down in there as much as I can. Like I told you on the phone earlier, there always will be a little bit of loss. Now I'm going to try and suck all that I can up in this syringe. So I'm going to lift it up for a second. so I don't spill it everywhere. And I've just got the syringe right down at the bottom of the puddle, sucking up as much as I can. Okay, and we could see, uh-oh, there's still some drug left in the bowl, but there's not a pile of it. Now, when I did my syringe, I left a little bit of, I pulled up some air, especially when I got down towards the end. So what I'm going to do, don't just push the air straight out, because that will send drug flying everywhere if it's caught up in the neck. So pull in some more air, then push the air out. Okay, it doesn't have to be 100% perfect. Just get most of the air out of there so you don't run out of room. Now you can see, maybe, now it's showing me I've got 1.1 mil in that syringe. If I turn it over, oh, there's all that powder. Okay, so what I'm going to do is add just a little bit of water, again using coffee here just so you have some contrast. Okay, you can either pour in just a tiny little bit like this. Okay, now that's probably a good 2 or 3 mil there. If you're not sure about how much to pour in, grab your other syringe, pull up 1 milliliter, squirt it in. Okay, find a way to measure it so you're not overdoing it. We don't want to use too much water because we still have to feed Einstein afterwards, and we don't want to fill his belly full of water and then dump in a bunch of food and have it go everywhere. So I put in a little bit of water. I'm getting the rest of that drug mixed in as much as I can. Okay, so I got it pretty well mixed up. Again, it's in water, so the drug is going to fall right down to the bottom. It's not a perfect suspending agent, but we don't have that available to us. So then I'm going to do, like before, stick the syringe down on the bottom, start pulling it up, go back and forth, kind of sweep up all the drug. And you can see now the bowl is pretty well clean. This spot here, that's just more of the coffee. There's little traces of drug, but like I said before, it's not going to be perfect. And I've got about 2.5 mil plus some air showing on the syringe. Now if I bring it up close, and I don't know if you could see, but right up here on the top, there's some caked on drug. And like I showed you before, on the other side, maybe you could see it rolling away, is more drug. So before you put it in the feeding tube, shake it well. I would pull in a little bit more air, okay, so it has room to shake. Cover it up, shake it up really well. Put it into the feeding tube. And if you get done and find out there's still drug in the syringe, which kind of got lucky here, there's just a little bit left. But if you got done and found out there's still drug in the syringe, you can always just pull up a little bit of water in there, little bit, don't overdo it. Okay, now we got about 1/2 mil, we'll even pull it back to close to 1 mil. All right, get some water in there, pull it back, again, shake well. Put it in the feeding tube. Got some air left. Don't shoot too much air in. You'll make him burp. So that's it. Easy peasy. Nice and easy. If you have any questions about what you've seen in this video, just give me a call. You know my number. And remember, I heart Terminator.